I remember it's March 4th. This is the first positive case. So we tested just one sample. And then after finishing the testing, the sample is positive.
And that was kind of the moment it all changed.
The very first sample tested for COVID-19 at the Houston Health Department's laboratory was positive.
So everybody is surprised. Come earlier than we expected.
We had to let Dr. Purse and the mayor know we had a positive case, and they were understandably surprised because they didn't know we'd even started testing yet.
With that positive test, the lab would become the frontline defense against this novel coronavirus.
But yeah, it was hectic in the beginning.
Samples came rolling in.
17 counties, they sent the sample to us.
It was all hands on deck, but there were only 3 sets of them.
In the very beginning, we only have 3 people working here. Sometimes I work for over 14 hours a day.
Each COVID-19 sample had to be tested manually.
In those shifts, you stayed in the pepper as long as you could up until your cutoff time. Then you switched out with your partner, you took your break, and then you would come back and continue on.
It was clear that COVID wasn't going anywhere. The lab had to scale up at warp speed.
COVID kind of, well, let's say, gave me an opportunity to actually use my degree.
Harold O'Dilly was one of the many new hires in the summer of 2020.
I would like to call it like constant work every day. And the following day, it's a continued repeat.
While everyone else went into lockdown, the lab went into overdrive.
We know all the procedure. Nobody can get infected, but everybody's okay.
This wasn't the lab's first rodeo.
Swine flu. Later on, we have the MERS. We also have Ebola.
Just like the virus, the lab had to multiply and mutate to keep up with COVID-19.
One of the positives was we went from being a broke government lab to being fairly flush with grant funds.
The Houston Health Department lab and its location in one of the largest cities in the U.S. made it a vital piece of the pandemic's response. Microbiologist Kadisha Earl knew their increased testing capabilities would be crucial.
We switched from manual earlier on to a high throughput automated system. If it's automated, it's more accurate. There is not room for much technician error, and it takes out a lot of the failed tests.
Federal dollars turned the lab into a state-of-the-art facility, complete with automated machines to analyze the samples.
An endless loop of samples, get them done, extract. On a normal day, I would say like 400 or 500. When we were really, really busy, it was about over 1,000 a day. There was some days we actually crossed 2,000.
We can do near 10,000 a week.
Lab manager Roger Seeley was at the helm during the transformation.
My job is to make sure that everybody else has what they need to do their job. Try to read the tea leaves as best I can and predict what's coming.
Lead microbiologist Ming created the software program the lab uses to interpret the machine's results.
Right now, I call PCR office.
The Houston Health Department lab continues to meet every challenge.
Just keep putting your best foot forward every day. Just keep moving. Honestly, at a point in time, we kind of became masters of the craft.
Surge after surge through Delta, Omicron, and whatever else comes next.
The freedom to learn and cross-train interdisciplinary in the different sections here is wonderful, and I don't think that's something that you would get anywhere else.
Even this team of brilliant scientists had something to learn from COVID-19.
I didn't realize I was this resilient.
For HHD, I'm Priscilla Key.